We call the hearing to order and thank the senators who are here, and to mention that the issue that we are discussing today is a very sobering issue, and is an issue I think does not get the kind of attention that it deserves. And let me thank Ranking Member Collins for her interest in the topic. Let me thank Dr. Kathleen Harris, Dr. William Cook, and Police Chief Robert McKenzie for joining us for this hearing today. They're going to be with us virtually. In the United States Congress, we have our differences of opinion, to say the least. But I think every member works hard on the issues of importance to his or her state or congressional district. But I think sometimes we may, in the midst of our work, lose sight of the big picture, the really big picture of what I think all of us want to accomplish. And very simply stated, what I want, and I believe members of the committee want, and certainly the American people want, is to create a nation in which the people in the United States can live long, healthy, happy, and productive lives. At the end of the day, that's what we are fighting for. Unfortunately, the issue we are discussing today, as I mentioned, does not get nearly enough attention, but it is surely an ongoing tragedy, something that we need to focus a lot more work on. And that is that here in the wealthiest nation in the history of the world, where we spend far more per capita on healthcare than people in other countries, the truth is that our life expectancy, how long our people live, trails behind many other industrialized countries. And tragically, and the question of today, what we're discussing, is life expectancy in the United States right now for many, many people is in decline. And when we discuss the issue of life expectancy, the real outrage, it seems to me, and this is above and beyond the horrors of the COVID pandemic, is that not all of our society is seeing a decline in life expectancy. What we have seen over the last number of years, again, pre-COVID, is that this declining life expectancy is impacting lower income and working people in a very significant way, people with less education and people who live in rural areas. In terms of life expectancy, as it happens, the very wealthy are doing just fine. The crisis impacts particular people, working people, lower income people, people living in rural communities. One of the most alarming facts, I think, that we have to address as a nation is that today, and I want everybody to hear this, an upper income male lives 15 years longer than the poorest male. And the gap between women is 10 years. According to a report by the Health Inequality Project from 2001 to 2014, the wealthiest Americans gained approximately 3 years in life expectancy, while the poorest Americans experienced no gains. A 3-year difference in life expectancy may seem trivial. What's 3 years? But as the report's authors note, this gain in lifespan is the equivalent of curing cancer for only the wealthy. Imagine that. Wealthy get cured, everybody else does not. Let me give you another example. If you are upper income, if you have stable housing, if you have access to decent medical care, you're doing fine today. In Fairfax County, Virginia, for example, the median household income is $124,000, and the poverty rate is just 6%. A child born in Fairfax County, Virginia today could expect to live to 85 years of age. That is pretty good. It's pretty good in terms of international standards. It is good. But in Scott County, Indiana, where Dr. Cook has his medical practice, the median household income is $48,000, and almost 14% of the community lives in poverty. A child born there today could expect to live only 71 years. Imagine that. 14-year discrepancy between Fairfax County, Virginia, Scott County, Indiana. In other words, what we are discussing today, and this is such an important point, is poverty is not that, you have a big house, I have a small house, you're driving a fancy car, I have a broken old car. That's not what we're talking about. What we are talking about is that if you are wealthy in America, you will live many, many more years than if you are poor. So it's not a question of luxuries. It's a question literally of poverty and stress being a death sentence. And all of this is preventable. And I think and hope that all of us can agree that this reality of today is a moral and economic failing. Over the past 10 years, the disparities have grown exponentially, and this is above and beyond the onslaught of the COVID pandemic, which has done, all of the horrible things and the deaths that it has caused. As we will hear from Dr. Harris today, mortality is now flat or rising among most working-age populations. Socioeconomic disparities have widened substantially, especially by education levels. People who have obtained a bachelor's degree are doing much, much better than those who have not gotten that quality of education. And what makes this even more stark is that many of these premature deaths are preventable. This is not about needing more advancement in medical research. In fact, cancer death rates are declining for more than half of the most common cancers in the U.S. We are making significant progress in many areas. This is not about healthcare. We are seeing a nationwide crisis of what doctors call, quote, deaths of despair. Deaths of despair, end quote. What does that mean? It means that we're seeing an increase, and we'll discuss this today, of drug overdoses, opioid epidemic, alcoholism, and even suicides. A Stanford neuroscientist, Robert Sapolsky, who has been speaking and writing on this topic for decades, offers a simple answer as to why we are seeing this decline in life expectancy. Poverty and economic stress is what he says. The psychological impact of being poor. A life of poverty can mean a life of constant stress. And this is the point that I think people don't understand. Again, it's not having a fancy car. It's living every single day wondering how you're going to feed your kids, how you're going to pay the rent, how you're going to prevent yourself from being evicted. What toll does that have on all of us? It's extraordinary. The poor have little control over their work schedules, whether they have jobs, how much money they make. They fear suddenly losing the job, being unable to pay their electric bill. What happens if your electric bill goes out? What happens if you don't have a cell phone? They despair over their own future and how to give their children a better life. They are exhausted and socially isolated by second or third jobs, long commutes, and weekend shifts. They lack the means to take much-needed time off or pay for relaxing hobbies. And often their social support systems are decimated by incarceration, addiction, and depression. And I can go on, but I think I've kind of laid the table for what I hope we will be discussing today. I know Senator Collins has long been interested in these kinds of issues. We appreciate